Men over 50, let me ask you an important question. What if there were a single area on your body that, when treated correctly, could help drive fresh blood toward your most intimate regions, revive sensitivity, and allow you to wake up feeling closer to how you did decades ago? This spot is not on the shaft. It is not a muscle you train at the gym. In fact, most men have never even considered it. Yet through many years of clinical experience working with male sexual health, I have seen one simple routine, combined with a commonly used natural oil, help restore confidence and performance in ways that genuinely surprise men. Today, I am going to explain exactly where this area is, why it plays such a powerful role, and how you can begin using this method to naturally support erection strength without pills or complicated devices. By the end of this video, you will clearly understand why castor oil can support blood flow, nerve sensitivity, and hormonal balance, along with where to apply it, how often to use it, and what kinds of changes you may notice over the coming weeks. Stay with me because the details truly make a difference. Before discussing the exact location and application method, it is important to understand what typically changes inside the male body after the age of 50. An erection is not simply a moment of desire or a basic physical response. It is one of the most complex processes the body performs, requiring precise coordination between the brain, hormone signaling, sensitive nerve networks, and responsive blood vessels. When even one of these systems slows down or becomes less efficient, erections can feel weaker, slower to appear, or less dependable. Over time, the blood vessels that supply erectile tissue may lose some of their natural flexibility, making it harder for them to open fully and allow the strong surge of blood needed for firmness. Even when blood does enter the tissue, it may be more difficult to keep it trapped within the erectile chambers. At the same time, testosterone levels, which support desire and tissue health, can gradually decline. This shift can affect energy, mood, and erection quality. Another often overlooked factor involves the tiny nerve endings that carry pleasurable signals from the penis to the brain. With age, these nerves can lose sensitivity, meaning stimulation that once produced a strong response may now feel dulled. The pelvic floor muscles also play a critical role. These deep muscles act like a locking system that helps keep blood inside the penis during an erection. When they weaken over time, firmness can fade sooner than desired. Many men assume this gradual decline is unavoidable. Based on long-term clinical observation, this belief is simply inaccurate. Even after 50, the body retains a strong ability to recover when it receives the right type of stimulation and support. When the correct muscles, blood vessels, and nerves are addressed together, vitality can return in a way that feels almost like reversing time. This is where castor oil becomes an unexpectedly helpful tool. It is not a miracle cure, but when applied correctly to the proper area, it can support circulation, reactivate understimulated nerves, and help condition the pelvic region for stronger, more reliable erections. Castor oil is not just an ordinary oil. Its unique composition includes a compound known as ricinoleic acid, which gives it notable properties. This compound supports the reduction of deep tissue inflammation, helping calm areas that may be tense or irritated. It also assists blood vessels in relaxing, encouraging improved circulation of oxygen-rich blood. Additionally, it supports lymphatic movement, helping the body clear waste products that can interfere with tissue health. These qualities explain why castor oil has been used for centuries in traditional practices, often applied to areas needing deep, sustained support rather than surface-level relief. When it comes to male sexual health, castor oil's ability to penetrate deeply into tissue is especially important. It moves beyond the skin to reach areas rich in blood vessels and nerve endings. Applied to zones that influence erectile function, it can help muscles release stored tension, improve blood vessel openness, and nourish sensitive nerve pathways. This process can feel like gently reactivating systems that have been quiet for years, leading to improved sensitivity and a stronger connection between the brain and body during intimacy. Many men describe the sensation as a gradual awakening, marked by warmth, fullness, or tingling, reflecting improved circulation and nerve response. The specific application area is not on the shaft itself, as many expect. It is the perineum, the soft, slightly muscular area located between the scrotum and the anus. Although often ignored, This small region is a major control center for erection strength. Beneath it lies the bulbous spongious muscle, which helps trap blood in the penis and maintain firmness. Important nerve branches that carry arousal signals also pass through this area, along with arteries that supply blood directly to erectile tissue. Applying castor oil here delivers its effects directly to the pelvic floor, encouraging muscle relaxation, improved blood flow, and renewed nerve activity. To use this method properly, begin by ensuring the area is clean and dry. Use a small amount of pure, cold-pressed castor oil, warmed gently between your hands or in warm water. Once comfortably warm, massage the oil into the perineum using slow, firm, but gentle circular movements. Apply enough pressure to feel the underlying muscle without causing discomfort. Spend at least 2 to 3 minutes allowing the tissue to soften and absorb the oil. Slow breathing during this process can further help release tension. For additional benefit, placing a warm compress over the area for about 15 minutes afterward can enhance circulation and absorption. This routine is best done in the evening, when the body is naturally winding down, allowing the tissues to remain relaxed overnight. With consistent practice, some men notice subtle sensations within days, such as warmth or tingling. For others, clearer improvements, including stronger morning firmness or improved endurance during intimacy, may appear after 2 to 4 weeks. This is not a quick artificial boost, but a gradual process of retraining the body's natural mechanisms. Some men also report improved pelvic comfort, reduced lower back tension, and even better bladder control, reflecting the interconnected nature of these muscles and nerves. Castor oil works best when supported by healthy daily habits. Staying hydrated supports circulation, while foods such as leafy greens and beets help the body produce nitric oxide, which allows blood vessels to open more fully. Healthy fats from sources like fish, nuts, and olive oil provide essential building blocks for hormone balance and vessel health. Gentle pelvic floor exercises can further strengthen the muscles involved in maintaining erections. Managing stress is equally important, as chronic tension can restrict blood flow and suppress desire. Castor oil is generally safe for external use when it is pure and unrefined. Avoid applying it to broken or irritated skin. If you experience unusual pain, sudden changes in erectile function, or have ongoing medical conditions, consult a qualified healthcare professional to ensure this approach fits safely within your overall care. The goal is not just improvement, but long-term support for overall health. Remember, the male body remains adaptable even after 50. With consistent care, proper stimulation, and supportive habits, it can regain strength and responsiveness. This simple castor oil technique, combined with healthy lifestyle choices, can help create lasting, meaningful change. Be patient with the process and trust your body's ability to respond. If you found this information helpful, consider sharing it with someone who may benefit. Small insights can make a meaningful difference. Subscribe to my Health First channel for more health videos.